Welcome to a Community Partners interview where we explore the organizations, opportunities, and resources that look to make change in our daily lives. I'm your host, Davy, and you're listening to Voices for Ability Radio. All abilities, all the time. Today, I'm joined by Jenni Timmons, President and founder of the Canadian CDLS Foundation. The Canadian CDLS Foundation's mission is to ensure every child born with CDLS in Canada thrives from birth to old age. The CDLS Foundation also empowers families to care and advocate for their family members with CDLS and provides support, resources, and education to families, care providers, educators, and clinicians of individuals with CDLS. Thanks for joining us today, Jenni.
Thank you for having me.
It's our pleasure. Well, to begin, for any of our listeners who are just joining us for the first time or who haven't listened in a while, why don't you tell us a little bit more about yourself and what inspired you to create the Canadian CDLS Foundation?
Sure. So my name is Jenni, pronounced Jenni. And I have been doing this now formally since 2019 with the Canadian CDLS Foundation. So I am originally from Finland, and I immigrated here when I was 8 and have since mostly lived here in Canada. And my husband and I have 2 children, one of them who is 18 and was born with Cornelia de Lange syndrome. And so 18 years ago, when she was born in Thunder Bay, Ontario, which is up north. And again, we were given a diagnosis at 3 months of age. The first geneticist we had said she's never going to be able to walk, talk, or do anything. I didn't take that answer well. And so requested that we get a geneticist who is familiar with Cornelia de Lange syndrome. And we did get that and had a much better experience with regards to how we could sort of support our daughter. And in the end, we ended up sort of traveling across Ontario and into also Quebec in terms of trying to find proper care and support for her. And at the time, there was there was one gene that had been found, the NIPBL gene, that was found to cause CDLS, but that genetic testing wasn't accurate at the time. So hence, clinically, she fit the criteria in terms of signs and symptoms of CDLS. And so she was given a clinical diagnosis. And aside from her, she's doing very well. She's 18, loves socializing and disco partying, going out to dances. And regardless of that, I'm also a nurse by background. And when she was born, and I was almost 10 years into my career as a nurse. And it was a very different experience to be on the receiving end of care in very complex situations, from intensive care units to multiple sort of interprofessional team members that all sort of had a pie piece, but nobody really saw her as a whole. And at that time, I had worked in acute care and public health. And then started navigating the healthcare system from the patient's perspective. And we ended up going to the US for a lot of our care. And again, publicly funded healthcare systems are great if you have sort of a popular diagnosis. But if you're in the rare category, it's very difficult to get clinical experts, and it's very difficult to access care. And oftentimes, many things are dismissed as the primary diagnosis of a rare syndrome, like, oh, it's just a part of CDLS. I sort of started getting into that whole world informally. And fast forward, after a small stint in Montreal, where again, this is navigating the healthcare system in Ontario, speech language pathologists cannot diagnose speech language impairments. And so a pediatrician has little to no training in complex speech and language disorders, of which is very common in CDLS in terms of apraxia, selective mutism, and other sort of complicated speech and language disorders. And so we moved to Quebec for a year to get access to a speech language pathologist, where in Quebec they're allowed to diagnose. And so we had somebody who was specifically trained in motor planning. So after that, we ended up in Toronto, and I was still working full time in the healthcare world, more at an executive level. And then took an opportunity I had informally been doing this with a few of my daughter's healthcare providers in terms of facilitating referrals to families that I had found. So it really started off as an informal group of families coming together, and me and my expertise from my own world as a nurse, as well as my US contacts and my local contacts here in Ontario, helped facilitate families to access expertise in terms of funneling. So, hey, my daughter goes to see so-and-so, and she's an expert in CDLS. And at that time, really, there was 1 or 2 that had seen more than a couple individuals with CDLS. And there are probably more, but those things are not mapped. So oftentimes when families go with their child to see a clinician, they don't know whether they've seen anyone or not. So at that time, we started finding more and more families. Me and Dr. Peggy Marcon, who was at the time my daughter's gastroenterologist at Sick Kids, started. She of course can't share who she sees because I'm outside of the care circle, but I started connecting and sending families to go see her because almost 98% of individuals with Cornelia de Lange syndrome have some sort of GI issues, and some of them are life-threatening. But majority have reflux at least, if not esophagitis. And so that's sort of how it informally started back in 2013, 2014, and 2016, 2017. The group started getting bigger. We started creating more Facebook groups, private Ontario, and then different provinces as people started sort of connecting each other. And then in 2019, Dr. Peggy Marcon's like, we got to formalize. Ridiculous. You're sending me people and I can't talk to you and I really need to, So we registered ourselves as a not-for-profit at the time. So in Canada, again, you have to be a not-for-profit for 1 year before you can register as a charity. And so then in 2021, we received our charity status. And really at that time, it was a way to formalize our work, as well as trying to get some credibility in terms of trying to raise some funds to try and figure out what is it that we could do that's most meaningful to families to help them through this very complex and often lonely journey. So we had spoken before a little bit about CDLS and what we do as a foundation. So we've expanded our services in terms of I provide 7 days a week support virtually to all our families across Canada. Our clinicians are available. I would say so we've built a clinical team, I think, since we last spoke, and we've expanded in terms of we have clinical advisor who's a clinical geneticist who's been trained in CDLS by our US CDLS experts, Dr. Vonda McNiven, and of course, Dr. Peggy Marcon, who's our pediatric gastroenterologist. We have a pediatric neuro-ophthalmologist, Dr. Michael Wan at Sick Kids. So really, in terms of Ontario, we're trying to elevate the quality of healthcare for those individuals, making sure they have access to those clinical experts, because oftentimes individuals with CDLS do not present in the same way. So we're quickly trying to first of all, funnel those referrals to existing pediatricians who might be seeing, for example, we have 4 families in Windsor. We want to make sure that they're seeing the same pediatrician, the same GP, the same GI, so that, every clinician doesn't have to learn from scratch, because there's a lot to know. And a lot of those appointments are very lengthy and timely if you've never actually seen anybody with CDLS, and they present very differently and can often be dismissed. So we've sort of, since we spoke, we've expanded on the clinical advisors. We've also sent that team and some families to the US, who are really the world leaders in management of Cornelia de Lange syndrome. And so last September, we funded our clinical team to attend the US CDLS meeting US CDLS experts, building collegial relationships with them, as well as supporting our individual Canadian families, in this case, New Brunswick and Nova Scotia, who have very, very difficult to access issues to basic primary care. And to the point where they're waiting 3 years to get a referral to IWK, which is the Halifax Main Hospital. So we have some major third world issues, in my opinion, in Canada in terms of being able to access basic care for very complex patients that really their quality of life and their entire family's quality of life is challenged. So that's kind of the medical side in terms of we do virtual online consultations where I do a basic health assessment, and then I help navigate the healthcare team within their community and make sure that they get to the right people. I'll oftentimes contact clinicians, prep them, send them medical packages so that they are informed and understand the complexities of Cornelia de Lange syndrome. So oftentimes families might call in from a clinician's appointment with me and their loved one with CDLS and the clinician, and I'll participate that way virtually. Our clinical team is available, so they can be called. For example, we've had some challenging cases here in Ontario where we have individuals who are in the ICU with very challenging situations who are able to call our clinical team on their cell phones, who are the CDLS experts, to get consultation, etc. So that's the clinical side. We also try and make sure that everyone has access to the funds that are available to them. So because Cornelia de Lange syndrome often comes with a multitude of different diagnoses, autism being potentially a secondary or tertiary diagnosis, they actually don't qualify for a lot of programs. So even though the needs are often the same or if not higher, this is the popularity contest here in public funded healthcare, is that the more people there are, the more funding you're going to get. So if you have the sexy diagnosis of autism, and I'm being completely sarcastic about that, but if that's your primary diagnosis, I was just talking to another group of moms yesterday with a different syndrome who didn't get the syndrome diagnosis till later, but the primary diagnosis is autism. So they have access to, up to $37,000 in just behavior management support annually, whereas some of our families who have those exact same needs, if not more, get nothing. So there are some equity issues across healthcare in terms of access to care. And of course, Ontario being very broad, we have lots of First Nations community families that have very different access issues. So those are kind of things that we're trying to navigate and solve. So that the medical and funding side, we're trying to put together regularly family sort of gatherings where we come together. We had one in Leaside a couple of weeks ago where we had our clinical team as well as our families from the GTA come together and for an afternoon of sharing and support, as well as Q&A with our clinical experts. So our speech language pathologist, who also works in the cleft palate and lip program at Bloorview and has been really dedicated in her time and expertise, and also sees a lot of our CDLS people, and as well as Dr. Peggy Marcon from a GI perspective, providing quality questions and answer periods for families where they can openly discuss the challenges that their children have. Now, most of those people at those events see both of those clinicians, but it's much more of an informal way. And this is on the weekend, and our clinical experts, our physicians, and other rehab specialists provide their spare time and volunteer at these events for an entire day. So those are kind of the variety of different things that we're doing. I'm not sure what else to elaborate on. I think where we've sort of here physically in Toronto. And so what we're trying to do is navigate not only the healthcare system, but also the resources, but also the community side. So we have a lot of individuals who are in their teen and early adult years. And so when you age out of high school at 21, there's not much there. So we have because it is a spectrum syndrome, we have sort of challenges with accessing day programming. So you have the far side of those who need significant support, and then you have those that have gone to college and can read and write, but they're oftentimes unable to obviously work a full-time job. So many of them are at home, not working, not going to school. Day programming is the criteria sometimes is as crazy as, do you have red hair or do you like pink lipstick? In terms of, you have to be continent, you have to have this, and you can't have that, or you have to be continent. And the criteria is extremely rigid in terms of accessing those services or day programs. And then employment is another issue. So we have many who are capable of working a couple hours a day, for example, at Winners, organizing hangars, whatever it might be, working at coffee shops, etc. Placements perhaps they've done in their co-op, but then actually getting a job is very difficult. And even volunteer roles in these kind of extended relationships with their co-op partners are very challenging. So we're trying to explore sort of community partners within, especially Toronto. We've done some work with not-for-profit Eparea, where we've tried to just connect, first of all, our young adults with CDLS here in Toronto to join their social events like karaoke nights and cooking classes at Longo's or whatever it might be, so that they have somewhere to go and something to do. So that's that component. And I would say, going back to our mission in terms of ensuring that every Canadian born with CDLS thrives from birth to old age, we've end up expanding that. So as I mentioned before, we have a clinical geneticist, Dr. Rhonda McNiven, who we're referring all of our Ontario CDLS patients to, who she can see all the way from birth to old age. So there's some consistency. So when we talk about the medical world where they age out at 18 and they end up with no GP, no healthcare providers, that's the one constant that can oversee making sure that they transition to adulthood and can continue to see them every 2 years to make sure that anything that and she's an expert in CDLS in terms of what medical issues arise. So what's also happened is that we've supported individuals to go seek out molecular testing. And as you know, since the human genome was mapped after, for example, my daughter was born, we now know that there's at least 8 genes that when there is a change can cause CDLS. And we know that those gene changes, depending on which one you have, results in certain medical issues and perhaps behavior issues and other sort of challenges. And so what then has come to light is that some of those individuals, we have just recently in the last month or two, we have 2 individuals, one in their late 20s, one in their early 30s, who has lived with the diagnosis of Cornelia de Lange syndrome since birth. But we've supported them to go get molecular testing, which basically the exome sequencing. And it turns out they have some other syndrome. So in one case, Kaufman syndrome, and in the other Rubinstein-Davy syndrome. And so we've expanded our mission, although we do have to edit that on our website, is that we do not sort of exclude those individuals. So they will continue to be in our CDLS community. So our mission statement will be revised to be ensuring that every individual born with CDLS or other isolating condition thrives from birth to old age. And so as molecular testing continues, and we have many in their adult stages who might get another diagnosis. But for example, Rubinstein-Davy and Kaufman syndrome are much rarer than Cornelia de Lange syndrome. And we know that there are many people living in, for example, community living and residential housing and long-term care that probably have CDLS but don't have a diagnosis, or alternatively have been diagnosed with CDLS but in fact have some other genomic imbalance or syndrome.
And that is absolutely really informative and really expansive. I think our listeners will definitely take a lot away from that. So thank you. Jumping ahead here, honestly, you actually help breeze through a lot of the questions that I had for you. But on the one hand, in all of that, one of the big questions that came to mind, at least for me, is if a person were interested in volunteering with the CDLS Foundation or becoming a member, what would the process be like?
So we don't have a membership model. We do have a member request on our website, and I'll tell you a little bit about more of that. So we do not have membership fees. We do not ask our families to pay a membership fee. They are already financially paying for so much healthcare services, some up to $30,000 a year just in basic speech language therapy. So we do not ask for any money from our families. And the only we request, if you go on our website and it'll say become a member, it just means that you have access to a private app. And anytime anybody joins to become a member, I verify that they're actually a caregiver or a loved one of someone with CDLS, because we have our app, our Spaces app, which is part of the Wix website platform, is a private space where families can have chats, share videos. We also have unedited, our podcast, which is called CDLS Connections. We provided an unedited raw version for our families, as well as some video interviews that we've done with families. So we'd like to put our content there as raw and as fast as possible, because it is just me doing. Aside from our clinical team, it's just me that, does all the podcasts and does all the family support, updates the website, does the donation receipts, everything. So it takes me a long time to edit a YouTube video, for example, or edit a podcast. And so the members page really is just making sure that for the safety of the families, that there's only people who are related to CDLS in terms of they're a loved one or a caregiver of somebody with CDLS. So we have sort of chat groups in there for school-age children, for adults with CDLS. So we have a lot of adults who can read and write and have a job, and they want to connect with others with CDLS. We also have, people in different stages or different medical situations that app and that member sort of area allows us to have more transparent conversations without the public seeing all that. So we don't have membership fees. The second, in terms of volunteering, we're always looking for volunteers, especially in our fundraising efforts. We also love volunteers for hosting family events. So right now in Ontario, I would say the GTA is probably the most active, although we have sort of larger communities in Ottawa and Montreal and Alberta. We have kind of a big group, and of course, Vancouver. But they've really just been connecting virtually. And really with anything else, it probably requires me or somebody from our foundation, some of our volunteers, to actually just book it and say, okay, this is what's happening. It's at this location at this time. Please come. So because that's how it started here. It was just me having people over at my house for coffee, just super informal. And then now that group has, where they do sort of their own getaways, and they've, some big have become besties, and they go to beach vacations together. So that's probably one thing, is we're looking for volunteers to host family gatherings. We're also looking for volunteers to any kind of admin assistants that have skill sets that would like to contribute. I spend a lot of my time to administration, which is not a good use of my time. I mean, it's important work, but at the same time, it's sort of from an efficiency perspective. And then also looking for sponsors and donors. That's probably where we're focusing on now. We do not have a lot of money in order to even just to keep the website and the phone going, and our insurance and our bookkeepers. That's getting close to $2,000 a month just in those kinds of things. And so we've tried to get to what you had probably seen on our website, which is the 5 Friends fundraiser. So find 5 friends to donate $20 a month to help support us with regards to starting a clinic here. Now that we had aimed for May 10th, which is International CDLS Awareness Day. It is an international event, and we were trying to get that into the Canadian calendar. There was a process you have to do with the government to get that as an official awareness day. But our plan was to have a clinic, and we had one of our local hospitals in our GTA willing to host that. The problem has become in terms of accessing behavior and psychiatric expertise at that event. So when we inquired about families who wanted to attend, absolutely want to see a pediatrician, developmental pediatrician, who we're still trying to recruit. So we've tried Sick Kids and Surrey Place, for example, where a lot of our individuals with CDLS go. However, they're swamped. They don't have the capacity or the, I think interest is also maybe not so. It's too sort of specific for many clinicians. But the behavior and psychiatric components, where we have people flying in from other provinces with severe access issues to behavior and psychiatric support. There is a lot of behavior issues that do arise with Cornelia de Lange syndrome that are very complex, that your local behavior therapist is oftentimes not skilled enough, especially if they're not connected to sort of a broader rehab facility that has sort of complex patients. And those provided by school boards often are not skilled enough to manage complexities with somebody with broad neurodevelopmental profiles, with CDLS, with autism-like characteristics, ADHD, OCD, and you start naming off all the other sort of challenges, response behaviors. And a lot of time when you don't have verbal speech, for example, communication is a frustrating problem, and also pain tolerance is quite high. And so a lot of the medical issues might be contributing to the behavior. So needless to say, the clinic has been challenging to be able to get the resources for it to be worthwhile for families to come all the way from across Canada to this clinic because of our inability to recruit specialists to that. Now, the US has been wonderful. Their entire behavior psychiatric team from Johns Hopkins and Baltimore area have volunteered that they would come up here and they would see and provide guidance, which they do continue to do for many of our, especially Ontario families who can't access Surrey Place, Bloorview, Sick Kids, CAMH. They provide one-on-one guidance. So Dr. Grados, for example, who's a psychiatrist specialized in Cornelia de Lange syndrome from Johns Hopkins Hospital, still continues to titrate medications for some of our Northern Ontario patients. Now, this is absurd to me, of course, that we have volunteer physicians from the US providing care, like talking primary care to Ontario residents who pay their taxes for publicly funded healthcare that they cannot access, nor do we have the expertise for. So that's an extremely frustrating piece. So at this time, the clinic is on hold until we have the right expertise, and even just finding somebody who's willing to come and do that clinic with us and see these patients. So that's kind of the 5 fundraiser, and we're looking for volunteers to help not only recruit physicians, but recruit sponsors and donors within their communities to help, compensate for the taxes that our families pay that don't get the healthcare that they need. So now we're going to try and do it from a charity perspective, which is unfortunate. So, I mean, the overall goal is that we don't need a charity in a first world beautiful country like Canada to provide basic healthcare. So that's the goal, is that in the end, we don't need a charity.
That's perfectly fair. Perfectly fair. And I can understand really how those costs would definitely impact your operations, but also what any family would go through. Now, to that end, I'm sure our listeners out there, if there's anyone interested, they would definitely, I'm sure, want to reach out and do whatever they can to help out what you and the CDLS and the Canadian CDLS Foundation do. Now, that being said, for any of our listeners out there who are looking for more information, be it to just volunteer or just or provide that extra partnership, that extra funding, help you out in any way they can, in any way that you need, how can they find you? How can they reach you?
So you can go to our website, which is www.canadiancdlsfoundation.com. You can also email us at support@canadiancdlsfoundation.com, or me, which is my phone number, 437-734-2357. And we also, obviously, if you're interested in following us on social media, we have a public Facebook page, we have Instagram, we have a YouTube channel, and we have a podcast called CDS Connections on all the platforms. So that's one way that people can support. Also, certainly we've tried our best to try and apply for different grants and funding. So through the banks, for example, but oftentimes they're looking for a number of followers on Facebook. And then you need to meet certain criteria in terms of who's running the charity. So many are looking for funding criteria in the DEI area. So we are making sure that we can qualify for those, since we do support newcomers as well as Indigenous people that live on reserve and off reserve, as well as, of course, the broader disability community. And we certainly want also individuals with CDLS and disabilities to reach out to see how they can support our efforts. We have lots of activities that we can modify to make sure that people have something engaging and worthwhile to do. And so we have some Toronto individuals who are working with us with disabilities in terms of helping to fundraise. And that's really just going door to door. That's contacting their local businesses and others. Of course, they need some support, but we're willing to orientate them and provide them the support that they need.
Fair enough. And thank you again for joining us today. With that being said, we've reached the end of yet another amazing interview segment. You're listening to Community Partners, presented by Voices for Ability Radio. All abilities, all the time. I'm your host, Davy O. Be safe, be kind, and I'll see you all next time.